Good morning, everyone. My name is Chris Westerfield. I'm a clinical pharmacist at Aegis Science Corporation and a member of the clinical team. Thank you for joining today's clinical update presentation. The topic of the discussion this morning is novel psychoactive substances. What is xylazine? So the objectives of the presentation are to describe what NPS compounds are and specifically xylazine and its drug information, recognize reasons and possibilities why some patients may be exposed to xylazine either purposefully or unpurposefully, and then discuss a rather graphic and unexpected adverse effect from the use of xylazine. We'll talk about how to test for xylazine, what the positivity rate Aegis is seeing in our testing, and what other substances are also present when xylazine is identified. So novel psychoactive substances are defined by the United Nations Office on Drugs and Crime as substances of abuse, either in a pure form or a preparation. They're not controlled by the 1961 Single Convention on Narcotic Drugs or the 1971 Convention on Psychotropic Substances, but which may pose a public health threat. I like to think of NPS compounds as research chemicals. Oftentimes, these molecules are made by illicit drug manufacturers as derivatives of approved drugs, or they may even be approved in other countries around the world, but not approved in our country or the country that it's found in. And ultimately, they're designed to avoid regulation. So if you add one atom of fluorine, for example, onto a fentanyl molecule, it's no longer a Schedule II controlled substance. It becomes a completely different molecule. Oftentimes, because of all of this, there's no good information on use in humans. Dose, the purity of the drug, what kind of side effects it may cause, all of that is usually very sparse. Many of these NPS compounds are technically not new or novel, but rather at the time that they're found in the drug supply, they may be new. Many of these compounds have history where they were developed decades ago by a pharmaceutical company looking to bring a new drug product to the market, but ultimately didn't get it on the market for myriad of reasons, such as maybe they were too addictive or the adverse event profile was not going to get approved by the regulators. So xylazine in particular, what is this? So it's actually a veterinary sedative. So it has approved indications for horses, a bunch of different kinds of deer, elk, dogs, and cats. There's at least 5 branded products in the United States that are all available as a solution, such as the one here, Rumpum, that was initially developed in the 1960s by German company for use as an antihypertensive agent in humans. But the clinical trials were stopped. I don't even know if an application was submitted to the FDA for approval, but the company stopped its development in humans because of side effects. It had too much central nervous system depression, too much hypotension. So it was never approved, or I don't even think it was submitted for use in humans in the 1960s or 1970s. Often what we see it in today's world is an adulterant in illicit drugs. So xylazine drug information, it's a potent alpha-2 adrenergic agonist. Its chemical structure is shown at the bottom of the slide. This resembles clonidine, tricyclic antidepressants, and phenothiazine, such as compazine, thorazine, or Phenergan. Xylazine decreases the release of dopamine and norepinephrine in the central nervous system, which causes sedation, muscle relaxation, and decreased pain sensation. There's also a lot of postulated mechanisms of actions, which involve a lot of different neurotransmitter systems, such as serotonergic, dopaminergic, cholinergic, even alpha-1, or even opioid receptors. Because it wasn't developed very much in humans, and most of the data is in animals, a lot of the mechanisms of action are going to be very much theoretical. In animals, it's given by injection either intravenously, intramuscular, or subcutaneously. The dosing is weight-based, so a quarter milligram per pound to 4 milligrams per pound. Sort of depends on what animal and what sort of indication that you're wanting to use it for. Onset of effect is very quick, so 3 to 5 minutes if it's given IV, and it can provide analgesia for 15 to 30 minutes. The sedation effects last much longer than that, so several hours for sedation. In animals, your side effects include hypotension, respiratory depression, and transient hypertension. And then in the clinical trials with some of the deer, so the uses in deer would be as like a dart, essentially. If you've got an injured animal or an animal where the vet needs to provide some kind of procedure on them, and clearly deer or wild animals are not going to let you do that. Capture-associated mortality was reported in the clinical trials with sedating deer up to 3.5%. So 3.5% of the deer that they were studying this on actually died because of the drug effect. So either my guess is they probably gave too high of a dose. I mean, if you're looking at sedating a deer, you probably don't have a very accurate understanding of its weight. So they may have given too much of the drug, or just the fact that this drug is very sedating and potent and can cause mortality. So 3.5% in the clinical studies of deer that it killed. Now, the questions that you may wonder about is, why is xylazine being added to illicit drugs? Where is this occurring? And there's not very good information about that, about when or why adulterates are added to illicit drugs. One of the consultants for Aegis, who's a retired FBI agent, thinks that a lot of the law enforcement are suspecting that xylazine is added after it gets into the United States. So not likely from the producer of the illicit drug. It's probably being added from more like a street level drug dealer. It can be used as a cutting agent. So if you've got a kilogram of an illicit drug and then you add 5 kilograms of a drug like xylazine, then you've got 6 kilograms of dope. You don't have 1 kilogram of dope anymore. So it can be a cutting agent. It can also prolong the effect of the traditional illicit drug. So when you've got an active drug like xylazine, you may have additive or synergistic effects because typically it's added with fentanyl or heroin. So it may give a longer effect. It also may give a more unique or marketable high where the drug dealers may get better business by having a more unique sort of product that they're selling. But the exact reason is not understood. So this information is from the third quarter of 2022 out of Philadelphia. So the Center for Forensic Science, Research and Education collaborated with the Philadelphia Department of Public Health, where they analyzed select drug samples. They compiled them and then they tested them. So these were probably seizures from law enforcement. And you can see the percentages of the drugs that were found. So fentanyl, xylazine, and then the 4-ANPP. 4-ANPP is thought to be an impurity from the illicit fentanyl manufacturer. But most of these samples contain more xylazine than they actually do fentanyl, which is not really surprising because fentanyl is such a potent drug on a milligram basis. You don't need a whole lot of fentanyl to get the sort of effect that you would like. But the bottom line is that xylazine is very much in the illicit drug supply, especially in the Philadelphia area. One of the really strange side effects of xylazine are these skin ulcers that people develop. We don't really understand exactly how they happen or why they occur, but they continue to seem to happen over time. A lot of case reports, things that have been published over the last 20 years suggest that it's definitely a consistent effect of drugs that are adulterated with xylazine. So they cause skin ulcers, necrotic tissue, and even abscesses that can get into the bone. In the periphery, xylazine is thought to cause vasoconstriction and decreased tissue perfusion. So you can imagine that all of those illicit drugs that were seized in Philadelphia were in solid form, but yet all the veterinary approved products are in solution. So it's likely that xylazine is being illicitly manufactured into some type of a solid form. So it's not appropriately diluted. And if you've got a vasoactive drug that's being injected intravenously, you're going to have probably some significant effects in that area right where the injection site occurs on vasoconstriction. And you could certainly have decreased tissue perfusion and develop infections and necrotic areas over time. An interesting part of these skin ulcers was reported in early 2000s out of Puerto Rico is that the xylazine skin ulcers are very, very painful. And I'm going to show you a picture on the next slide, and you'll see why. So what individuals had reported in that study was that the ulcers would start to form. They would become very, very painful, and then repeat doses in that same area were done because xylazine causes analgesia, and it also has anesthetic properties. So it even made it probably feel a little better as it was making it worse. But the underlying thought with how this occurs is ischemia, infection from chronic, probably re-injections from xylazine. So here's a picture of a xylazine-induced skin ulcer, a very, very ugly looking left leg here. This is a 37-year-old lady from the Philadelphia area. Actually, both of her legs look like this. She had a history of using 8 to 10 bags of quote-unquote dope every day, which was actually a combination of fentanyl and xylazine. When she came into the clinic, her vital signs were actually fairly stable. She had a temperature of 99.8, a blood pressure of 100/48, and her heart rate was 92. The ulcers were very foul smelling and had a bunch of drainage that actually extended into the bone in some places. She had a past medical history of opioid use disorder and skin and soft tissue infections and bacteremia secondary to her substance use. She reported that she usually injected the drugs in her hands, but sometimes in her legs, and that when she missed the veins in her legs, she noticed the areas around the injection sites began to get ulcerated. So the question is, why should you test for xylazine? Well, why we think providers should test for, a lot of drugs is it gives the provider the ability to assess their compliance to prescribed drugs as well as non-prescribed substance use. And if non-adherence or substance use is identified during a routine office visit, this can help the provider, either not use more medications or add on things, or sort of guide the treatment decision. Drug interactions can also be identified. Adverse drug events may also be revealed by objective laboratory testing. So, for example, if you've got a patient and xylazine is identified on a laboratory report, you may ask the patient if they have any of these ulcers, covered up under their pants, and lo and behold, they might. So this could allow for a discussion about that and how to best treat that. Now, the test method, does it matter? So there's several different test methods that can be employed: presumptive testing, the quick point-of-care cups that you can do in the office, or definitive testing, which involves laboratory equipment and oftentimes sending it off to a high-complexity laboratory. There's advantages and disadvantages to each type of testing method. It really sort of depends on what substances you're looking for and how accurate that you want to be. So Aegis performs definitive testing. We use what's called liquid chromatography and tandem mass spectrometry, the LC-MS, and this allows for identification of specific drug substances, including their metabolites. So every molecule has a specific sort of retention ratio and ions, how the molecules sort of separate under the mass spectrometer. And this can be very desirable in the behavioral health setting where medication adherence is oftentimes less desirable. So looking at Aegis's data for xylazine in 2002, you can see an unfortunate trend of positivity. So in the first quarter of 2022, 207 samples, all the way up to almost 1,400 samples in the fourth quarter of 22, which only went through December 15th. This could be a function of more testing, but the positivity rate also more than doubled between the first quarter and the fourth quarter of 2022. Other drugs that we see when xylazine is positive and present are fentanyl, fluorofentanyl, and methamphetamine. So by each quarter of 2022, you can see typically it was fentanyl would be the most common, and then you would have meth and fluorofentanyl were sort of neck and neck there for second and third. And then the fourth most commonly substance not shown here was in the first quarter was cotinine, which is the nicotine metabolite, second quarter buprenorphine, third quarter is cocaine, and in the fourth quarter methadone. So sometimes cocaine is added into the heroin or fentanyl xylazine combination because the sedation effects can be too great with adding the xylazine with the opiate. So the user would want a sort of stimulant, pick-me-up type effect. So certainly if you see fentanyl, fluorofentanyl, or methamphetamine in any of your testing, you may want to consider looking for xylazine. Aegis recently published a paper in the Journal of Addiction Medicine. So Andrew Holt and others titled Widespread Distribution of Xylazine Detected Throughout the United States in Healthcare Patient Samples. So this was a retrospective review looking from April 2021 to March 2022. They looked at almost 60,000 samples and found that 413 of those were positive in adults aged 20 through 73 from 25 of 39 states where it was tested. So certainly over that time frame of April 2021 to March 2022, you can see the increase from the data, in fourth quarter of 2022 on the number of positives. So unfortunately, xylazine is increasing in prevalence. So in conclusion, the illicit drug supply is very strange with a lot of these new synthetic NPS compounds, especially over the last few years, maybe driven partly by COVID. Xylazine in particular is an NPS drug that's often used as an adulterant in illicitly manufactured fentanyl, heroin, or even cocaine that has no human uses. It's a powerful animal sedative used to tranquilize deer and horses. Xylazine does not respond to naloxone. It can also cause some unique withdrawal episodes. So if it's in combination with an opiate, this can have a sort of strange picture, and it can cause these really, really significant necrotic ulcers, which may lead to amputations. Our data suggests that xylazine use is very much widespread across the United States in most areas. Certain areas, such as Philadelphia, have higher positivities. This could be due to test ordering patterns or from testing higher risk individuals. Here are the references. And if you have any questions, anyone from the Aegis clinical team, including myself, are available. Please reach out via phone or email.